Now at 6, stepping up the fight against coronavirus. The new tools to get ahead of the virus and flatten the curve.
Keep your distance. New Jersey's biggest cities are upping the ante to keep people inside their homes. The citations and businesses not following the rules.
I've aged 20 years in 2 weeks.
The front lines of the crisis, a harrowing first-hand account from a nurse in a COVID ward battling to save lives, including her own. Good evening. I'm Chuck Scarborough reporting from my home.
And I'm Natalie Pasquarella. New changes here at home to stop the spread of the virus as cases soar. Here in the city, 10 playgrounds are now closed in an effort to further enforce social distancing. Alternate side parking suspended another 2 weeks. Also, more than half of the 250 ambulances ordered from FEMA to help New York City are here, along with 500 EMTs. Governor Cuomo says he's also ordered 17,000 ventilators from China. And the Billie Jean King National Tennis Center in Queens is now added to the list of temporary field hospitals, expanding the amount of hospital beds by 350. Let's give you a quick look at the numbers now. New Jersey approaching 19,000 cases. 267 people have died. In Connecticut, more than 31,000 cases, 69 deaths. And New York saw its highest daily increase. That's more than 75,000 cases and 1,550 deaths. News 4's Andrew Siff live in Flushing with the new strategies, Andrew, to fight this virus here at home.
Right, Natalie, and what makes this field hospital in Queens different from some of the other ones is they will be seeing coronavirus patients here. Not the serious ones who need ventilators, but less serious cases, and the idea is to take the pressure off of inundated emergency rooms like the hospital really close to here, Elmhurst. On these tennis courts, just days from now, hospital beds. And unlike the other makeshift facilities that have opened, like the Javits Center or Central Park, there will be coronavirus patients here at the Billie Jean King Center in Queens, up to 350.
Starting next week, this facility will be able to take people from Elmhurst, not folks who need ICU care, but other coronavirus patients.
Elmhurst, the hospital and epicenter of the pandemic in New York, endured 13 deaths in one day and long lines of people waiting to be tested. A doctor today telling us it is still overwhelmed.
They intubated 19 patients in the past 48 hours, 42 patients in the past 4 days. And that is way more than normal.
Governor Cuomo said it may soon get worse at other hospitals as the pandemic peaks in about 2 weeks.
The main battle is at the apex. We're still going up the mountain. The main battle is on the top of the mountain.
For Cuomo, the battle turned personal today as well. His brother Chris now testing positive for COVID-19 with mild symptoms.
He's a really sweet, beautiful guy. And he's my best friend.
State and city officials continue to urge New Yorkers to stay home and try and flatten the virus curve. An obvious challenge for tourists near the USNS Comfort on the west side.
Take your photos and keep walking, please.
And an ongoing challenge for those with essential jobs still taking mass transit.
I just make sure I wash my hands and I have my face mask. I don't know where anyone's traveled, so I'm just trying to not get sick right now.
And the MTA chairman, who has a mild case of coronavirus himself, said it's impossible to add service because so many MTA workers, 2,000, have been calling in sick, 4 times the normal amount. As for this hospital here, Mayor de Blasio said it will open next week and be at full capacity, 350 beds in 3 weeks. We're live in Queens. Andrew Siff, News 4 New York.
All right, Andrew, thank you very much. I know that from the beginning of this crisis, all of you watching at home and all of us certainly in News 4 have marveled at the courage and the dedication of our healthcare providers. But what's it like? What's it really like to spend all night on a COVID ward treating patients? Tonight, a Brooklyn nurse working in critical care gives us a first-hand view of the bravery and anxiety in a hospital critical care unit. The I-Team's Chris Glorioso is live in Essex County, New Jersey with her story. Chris?
Chuck, this nurse works with patients who have the worst prognoses. These are people on ventilators who are completely dependent on hospital critical care. We asked her to make a video diary, and it shows her courage. It also lays bare her authentic fear.
This is too much. I don't know how much longer I could do this.
Sheena Tanis is a Brooklyn critical care nurse who agreed to show us what an overnight shift is like, treating only the worst COVID-19 patients. These New Yorkers are not just on ventilators. Many are on dialysis and countless medication drips, too. She's the one watching them all night.
It's 10 p.m. I'm heading in to give medications to my COVID patients. It is so hot under all this PPE, but it's important that I keep myself protected in order to take care of the others.
Tanis works at Brookdale Hospital, hard hit by COVID, with a refrigerated box truck out back. It's a temporary morgue. Because Brookdale sits in an economically depressed community, Tanis says many of her patients have the risk factors that go along with that community: asthma, diabetes, and heart disease.
It is 11:15 and I'm still in the room with the patient, doing dialysis. I'm managing drips, managing the ventilator. It's not easy.
It's not easy to manage these critically ill patients and not easy to manage one's own anxiety. During her overnight shift, Tanis told us there is constant worry about the risk of nurses becoming infected themselves. They don't dare take off PPE.
This is the sweat that came off of me while I was in this room in my plastic gown. It is extremely exhausting.
For the rest of the night, the Brookdale critical care floor was too busy for Sheena Tanis to record more video diaries. She didn't press record again until the next afternoon as she got home to her 2 kids.
It's 12:19 and I just parked my car coming home from the shift. My face is breaking out from the mask. I look like I've aged 20 years in 2 weeks. This is too much. I don't know how much longer I could do this.
Sheena Tanis is the mother of 2 children with asthma, and I cannot say this enough. She, like healthcare workers across our region, cannot leave that fear and anxiety at work because they are afraid of bringing the infection home, so they disinfect themselves before saying hello to their families. And I should also point this out. Sheena Tanis is probably asleep right now because she works the overnight shift. She's going back tonight. Reporting live in Essex County, New Jersey, Chris Glorioso, News 4 New York.
All right, Chris. Wow. We thank her so much. Just unimaginable there. We want to talk about Connecticut now. The number of coronavirus deaths there nearly doubled in the past 24 hours. The official total there tonight, 69, up from 36 just yesterday. Connecticut health officials say the reason for that sharp increase is that a number of coronavirus deaths happened in the past 2 weeks and are just now being reported to the Department of Health. There are more than 3,100 coronavirus cases in Connecticut statewide, nearly 1,900 in Fairfield County. 38 of the 69 deaths are from Fairfield County as well, Chuck.
Well, Natalie, you know that the cases in New Jersey are also outpacing the nation right now, and police in the Garden State's biggest cities are having a difficult time enforcing that social distancing. In Newark alone, more than 160 people have been ticketed for non-compliance with that. Businesses are also being written up as well. News 4's Brian Thompson is live in Jersey City with details for us. Brian?
Yeah, Chuck, quite some developments in both these cities today. They're going to be expanding this testing center tomorrow here in Jersey City and one across on the other side of the city, as both these cities are grappling with how to handle what has been a growing number of cases of coronavirus and, in fact, doubling the death rate here in number of deaths, here in Jersey City compared to just a couple of days ago. But both cities feel they are making progress.
Hassan, 107.
Jersey City stepping up its testing as the numbers in this city keep rising. Deaths doubling overnight from 6 to 12. Positive cases heading into 4 figures from just a few hundred days ago.
It's very discouraging that this virus is everywhere.
And yet these health department workers continue to man the front lines here. Jersey City an early leader in curfews and business shutdowns. Figures its totals would be much higher otherwise.
That's probably for us about 2,700. So that's what we think it could have been within a month's time.
And this city not about to slow down, expanding who will be tested proactively.
You think about the grocery workers that were out there every day interacting with people, and they don't get a lot of recognition.
In Newark, police taking the social distancing battle to the streets. 100 cops today and multiple convoys sweeping the streets.
What did they say to you?
They told us go in the house.
They told you go in the house?
That's right.
161 tickets written yesterday to people who were gathering. This group would have been broken up if seen by police, likely ticketed as officials' patience has worn out. 15 businesses cited and shuttered.
Different stores, different ones that we're trying to deal out of the back door or open up. I guess they're looking to make some money, and they just can't right now.
Newark's parks have been cleared. For the most part today, we saw only 1 or 2 people at a time, and even that was a rare sight. And yet, police worry.
We're not going to contain everybody in the city. We don't have the capacity.
The state police colonel, Pat Callahan, did praise Newark for their enforcement action with those 161 citations yesterday and the 15 businesses closed. Meanwhile, there's a note of optimism from the governor today. Governor Murphy is saying that he is putting a skunk works team, into place on how to get back on our feet once this is over with. He just doesn't know when that will be. Live in Jersey City, Brian Thompson, News 4 New York.